Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with another video. Today's video, we are going to dive into the world of GBS or Group B Strep. Now, don't forget, if you find value in this video and in this information, first of all, share it. Share it with those who may be pregnant and expecting and need this information. And two, like, 3, comment, share, and subscribe. So let's dive right on in. So the big question is, what is Group B Strep? Or Group B streptococcus or GBS. GBS is a bacteria that is found primarily in the intestines and in the vaginal tract of some individuals. About 1/3 of women have GBS, and it's important to understand that it's not something that you contract. So I don't want you to worry that that is a thing. I don't want you to think someone gave you anything, or if it's a sexually transmitted infection. It's not. Just clearing that up. And just like it's not a sexually transmitted infection, it's not at all something that you are at fault for having. So I don't want you to feel guilty about having GBS or anything like that. So let's dive in. So how does one get tested for GBS? GBS is tested for usually around your 36th week of pregnancy in the office. It is caught by a swab that is sent off to the lab to be cultured. So usually it's like a giant Q-tip. If you think of like when they were testing for and swabbing for COVID, similar. They are going to take a Q-tip and swab you from what I say is rooter to tutor, from front to back, right over the perineal area. And they are going to collect the bacteria there, send it to the lab for processing. However, if you are in a second, third, or fourth pregnancy and you were GBS positive in your last pregnancy, your first pregnancy, then they may not even test you for it. They may just go ahead and assume that it's something that you colonize and keep and go ahead and just treat you like you have it. So what does it mean to be GBS positive? It means that you colonize, that word again, right? You harbor that bacteria within your body. It also means that you could potentially transmit GBS to your baby. However, it is important to understand that you, mom, will not get sick from GBS. I will not be tested for GBS because I'm not pregnant. And the only reason that we even look for it is because it can impact the baby after transmission. You won't get sick.
Editing Rainy here. I need to make a correction. Most women won't get sick from GBS infection. However, there's always that risk with prolonged rupture. If your water is broken too long, there is a chance for infection by way of chorioamnionitis. If you haven't watched our video on chorio, I'll leave it at the end of the video for your viewing. Let's continue.
Baby could get it. 1 in 2 babies get it. So that's a pretty high, number, 50% chance. The great news is that GBS is treatable, and it is treatable with antibiotics. It is specifically treated in labor. So you're not going to get treated before you go into labor. It's specifically done in the hospital in labor with IV antibiotics. Antibiotics are given to you. It's at the discretion of the provider, but some will give it to you as soon as you walk through the door. And some doctors may wait until you're in active labor to start you on your dosage. Now, to adequately treat GBS, they want you to have had at least 2 doses of antibiotics by IV before you give birth to the baby. The IV antibiotics are given 4 hours apart. So that's why it's important that once you know that your water has broken and you know that you're GBS positive, to go ahead and head into the hospital so that they can get those antibiotics on board, loaded, and ready to go. If you are a known C-section, then you will not be treated for GBS. So as long as your water doesn't break. If your water breaks and you are a scheduled C-section, so you're at home, your water breaks, you know you're going to have a C-section, so you go into the hospital for that planned C-section, they may very well give you antibiotics to treat the GBS because your water is broken.
Once again, it's Editing Rainy here. If your water breaks and you're a scheduled C-section, your C-section turns into that very day. Let's continue.
That means that that bacteria that is colonized in your perineal area, in your vaginal tract, your genital tract, that means that bacteria could find its way into the baby's environment because your water is broken. However, if you are a scheduled C-section and your water is not broken, then they won't treat you for GBS. Now, they will give you other antibiotics just because you are predisposed to infection with a cesarean section, but those antibiotics will be prophylactic, meaning they are protecting you before you have surgery, whereas the medication for GBS is strictly for GBS. So for babies, there are 2 types of GBS that we are worried about. GBS infection that presents as an early onset, meaning that it is noticed and recognized and diagnosed within the first 7 days of life. It causes meningitis, respiratory symptoms, pneumonia, and sepsis. And we are lucky if we can catch that in the hospital while they're there, so you don't have to deal with that when you go home and the uncertainty that comes with managing a sick baby at home. Then there's the late onset, which can be anywhere from 7 days to at 3 months out. Same symptoms apply, same risk apply, but it's a little scarier because you have to be able to pick up on those subtle signs that then become very serious. That's why it's important to go ahead and get treated for GBS when you're in the hospital, if at all possible, if you can make it to the hospital in time. The neonatologist or the pediatricians in the hospital will be aware of your GBS status, and they will monitor baby very closely. Unfortunately, there is fallout with babies having GBS infection. That includes seizures, cerebral palsy, hearing problems, developmental delays, and so on. So we definitely want to try and avoid it, and it's avoidable. So definitely make sure that you can get the treatment. So you're like, Rini, you're telling me all this. What do I do with all of this information? And you know, I've got you. First of all, I don't want you to stress. This module is not meant to stress you. It's just meant to inform you. There are tons of women, like I mentioned earlier, about 1/3 of pregnant women who have GBS get treated adequately and take home a healthy baby. So this is not to stress you. It's simply to inform you. The second thing I want you to do is whenever you call your doctor and you're going in for labor or something labor related, you always want to tell them, hey, my name is Jane. I'm 38 weeks pregnant. I'm having contractions pretty regularly now, and I'm GBS positive. Okay. Now I know you're like, they know that that's my doctor, but the doctor sees so many patients, and you know yourself, you see so many doctors. So we're not really sure who is going to intercept you when you go into labor and delivery. So you want to make sure you give them all of the necessary pieces to the puzzle so that they can make an informed, accurate decision, right? So they'll say, oh, Jane, oh, okay. You've been contracting regularly? Has your water broken? Okay, let's go ahead and get you in, get those antibiotics on board. Thank you for telling me you were GBS positive. And that's all, okay? So if you found value in this video, I want you to like, comment, share, follow for more. This is what we're here for, to educate the masses. Make sure you have all of the information that you need to make the best evidence-based decisions for you and your growing family. Congratulations.